Hey everyone, good day to all. Myself Dr. Ajay Maurya. So today I'm going to share you with some 100 plus one-liners for the upcoming examinations. Okay, so let's go ahead. So this is the first 50 MCQs. Okay, so this first 50 one-liners. Okay, now so for the PDF guys, the link in the description. Okay, so let's go. So here guys, so the first one is what is the first line treatment of cluster headache? Actually, this question was already asked in the last FMG examination, but this time they are going to ask you about that. What is the you have to diagnose the migraine? They will give the symptoms. What is the pneumonia for that one? P for what? Pulsatile. Is it the 1 day duration? Is the unilateral nausea and what disability in nature? Okay, migraine you have how to diagnose the case and what is the treatment is the sumatriptan. The drug of choice is the sumatriptan. Then they will ask they will also ask you guys what is the mechanism of action. It is the SSR agonist which binds the 5-HT 1B and 1D receptors which causes the vasoconstriction. Okay now. Then cluster headache guys, this is the 100% O2. First of all, you have to give the O2 therapy, oxygen therapy 100% for the 10 to 20, the 10 to 12 liters per minute for 15 minutes. Then you have to give the sumatriptan subcutaneously. Next one is the uh, difference between Parkinson's and Alzheimer's disease. You have to know about these two diseases very clearly. Okay, na? In depth, you have to remember because there is one MCQ from this one. Coming to the Parkinson guys, there is, I think you guys know, there is a what decrease dopamine, is a low dopamine, where in the substantia nigra. Okay, na? Substantia nigra. So here what happens, guys? There is a alpha synuclein protein. Here is the alpha synuclein protein is going to okay. This is the bad protein. Is going to accumulate. Is going to accumulate in the what substantia nigra, and a group of alpha synuclein proteins that forms the what Levy bodies. Okay, now. So what are the symptoms here? There is a pill rolling tremors. Okay, now see that is cogwheel tremors. There is a rigidity, bradykinesia, then shuffling gait, and micrography means there is a small handwriting in the Parkinson disease. There is a postural instability. Okay, now what is the drug of choice? It is the levodopa plus carbidopa. In the old age, guys, if the patient is above 70, above 80, then you can go for the drug of choice as a levodopa plus carbidopa. But in the uh, but but in the young patient, guys, we can go for the uh, D2 receptors agonists such as roticotin. Okay, now. And also try to review other drugs. Also, there is a MAO inhibitors like selagelin for the Parkinson's. Okay, now. The next one is the Alzheimer's. Please, while I am explaining about the Parkinson and the Alzheimer's, please try to open your notes and mark down all the important points. Okay, na? And coming for the Alzheimer's, guys, so there are many genes responsible for that one, but the most important one is the what chromosome 19 and the APO4 gene. Okay, na? APO4. These two are important one. And remember, sometimes they will ask you APP protein, that is the amyloid precursor protein, is where is accumulated where at the chromosome 21. Okay, now here they decrease what? They decrease acetylcholine here. Okay. Remember here there is a intracellular. What am I? Intracellular accumulation of a tau protein. Intracellular accumulation of a tau protein, which is called as what? Called as neurofibrillary tangles. Okay, which is called as neurofibrillary tangles. As you know that the severity of the Alzheimer's disease, it depends on the neurofibrillary tangles. Okay, the next one is the extracellular. Here is the extracellular accumulation of the what amyloid A beta 42. Okay, right? A beta 42 is called as what, Amma? It's called as neuritic plaque. Please try to correlate with the images. They will ask you, okay, so they will ask you, they will give this neuritic plague. As now that everyone knows this one, everyone knows that, okay, this is going to be the neuritic plague. There is going to be what, neuritic plague and the neuritic plague, and they will ask you what is the content. This is the amyloid beta A, okay, now, which is visualized on Bialchowski stain. Remember, and also remember, accumulation of tau protein and neurofibrillary tangles, they both called as what? There's a body called as what, Amma? Hirana bodies. It's called as what? Hirana bodies. Hirana bodies. Okay? Then what the treatment for the donepezil is the most commonly prescribed medication. Rivastatin for the patch form, okay? Galantamine you can also use, and also use mementamine. It is the NMDA agonist. It is the antiviral drug which is used for treatment of what? What? It is the Alzheimer's. Okay. I think I am pretty much sure about. I cleared everything about the Parkinson and Alzheimer's. Try to review my notes, and there are. I did many. I talked about the Parkinson and Alzheimer's in many videos. Just try to recall. Okay. The next one is the vertical gaze paralysis plus atypical Parkinson seen. Vertical gaze paralysis means the patient will they are not going to the patient can't move their eyeballs. Okay, now it means there is a vertical. There is only vertical. Okay, vertical paralysis meaning they can't move the eyeball to the sidewards. Okay, now so that he will move only on the what? Move. He will see only on upside on. That's it. Meaning whenever he's walking, what, he will easily fall down because he cannot move his eyeball down. That's why there is a recurrent fall here, and there is a atypical Parkinsonism, meaning the tremors will be what, more on the axis, not on the limbs. So this is called as what, progressive supranuclear palsy. What happens here? There is a superior collicus region going to superior collicus is going to damage. That's what this leads to the what, PSP. In MRI, we'll see the hummingbird sign. Okay. Next one. Next one is the what are the indications for thrombolysis in the ischemic stroke? It meaning that the patient came to you within 4.5 hours, you have to go for the thrombolysis, or else you have to do the medical to the pharmacological management. Okay, now so, and also you have to remember about that about the ABCD to is score for the what, for the transmic ischemic stroke. Okay, okay, now okay, TIA, please remember. Okay, now remember next one, the a patient with a patient is diabetic and having the heart failure. Patient is diabetic and heart failure. What is the drug of choice? Is the dapagliflozin, which is SGLT2 inhibitors blockers. Okay, now so guys, it is the SGLT2 inhibitors. So what is the side effects? It causes the UTI. It meaning what happened? Dapagliflozin, it is SGLT2. SGLT2, they are going to absorb the glucose back, but if you give this drug, dapagliflozin, canagliflozin, they are going to inhibit this channel, inhibit this SGLT2, meaning that's why what happened, all the glucose will be what, excreted throughout the urine. Okay, now urine. So if the more if the more glucose is coming out through the urine gas, obviously there is a side effect or what, UTI. Okay. The next question is the sixth one is the rheumatic fever. Okay, now that I'm talking about the rheumatic fever. Can I see whatever I'm talking here? Please try to build your knowledge and try to mug up everything about the topic. Just go ahead the topic and try to read everything about the topic. Okay, now see, next I'm talking about the rheumatic fever. It meaning you have to go to rheumatic fever and open that topic. Just revise. Okay, whatever I'm telling, just go there. Okay, now see. Okay, rheumatic fever with the cardiac involvement, but record prophylaxis given. Okay, now but record given until what, 10 years or until 20, either 21. There is a treatment of the rheumatic fever, guys. Please try to remember here. Whenever there is a wall involvement, when there is a cardiac involvement, okay, now only cardiac involvement, try to do the revision here. Also revise the minor and the major criteria for the rheumatic fever. Also remember the cardiac involvement, hallmark is what? Ask of body. Corecum, murmur and mitral regurgitation stenosis are most common. Next one, the seventh one, most common cause of infective endocarditis is it is the staph aureus. But in rheumatic fever, it is the group A beta hemolytic strep pyogenes. Okay. The next one, I am talking about the cobweb formation seen in Verama TB meningitis. TB meningitis. It meaning I am talking about the CSF analysis. So the CSF analysis, guys, you have to remember everything like the viral meningitis, fungal meningitis, bacterial meningitis, TB meningitis. Okay, so go to the topic and read everything. Next one is the finger to finger. It is the finger to nose thing. Finger to nose test. Finger to nose test. And what are this one is the this is the what? This diacokinesia. This is the these test. They will go see like this one. Finger to nose test. The same exact image they will give, and they will say what is the test name. Everyone knows that okay, this is going to nose to finger test. Finger to nose test. But what they are assessing, they are looking for the cerebellar lesions. Okay. Most commonly, we will do this. This will come on this will come on the CNS examination while the patient suspecting any like stroke. Okay, severe. The next one is the eyes test positive only seen in what? Only seen in the myasthenia gravis. Both myasthenia and the Lambert-Eaton syndrome involves the what? Involves the proximal muscle weakness. The most sensitive test for the myasthenia gravis is the what? Single fiber electromyography. Drug of choice will be the what? Pyridostigmine. Okay, na? Please once have a look about the myasthenia gravis and the Lambert-Eaton syndrome. I already included these topics in our short FMG short topics. Okay, na? In very clearly. Okay, na? Just go ahead. Next one is the TC technetium 99 sesta maybe scan is done for the what? Done for the hyperparathyroidism. Next one is the Nagma example what? What? RAD. RAD means what? Renal tuberculosis, Addison's disease, astrogermides, use and the area and GIT related problems. These comes under the what? Nagma, and remaining all it will comes under what? Hagma. Okay. Next one is the most common cause of epiglottitis, which is the step pneumonia. You have to read the questions very clearly whether they are giving that the patient is already immunized or not. If the children is unimmunized, then you have to go for the what? Humus or human influenza virus B. Or else you have to go with the step pneumonia. Okay, na? Just remember about that one. Group versus epiglottitis. Okay, na? Most important. See, whatever questions I am discussing, please pause the video and go to the topic. And try to mark all the important points. Actually. Next one. A tumor in the anterepituitary pituitary pressing on the optic chiasma. Then, okay, tumor on the anterepituitary pressing on the optic chiasma. Then case of what? Bitemporal hemianopia. So these are the most commonly asked questions. Try to correlate with the images and the other options. Okay. Other conditions also. Next one. High dose dexamethasone suppression test. If ACTS still high, it means what? It means what? It is going to the ectopic ACTS, which is associated with what? Associated with the small cell carcinoma of the lung. I explained these high dose and low dose dexamethasone suppression. It is to know the reason for the Cushing syndrome, for the Cushing disease. Okay, now? Low and high dose dexamethasone suppression test we will done. This is done in the case of Cushing disease, guys. Whether we have to know what are the causes. Either it is atherogenic cause or by pituitary tumor or by lung cancer. Okay, na? So here we did the high dose dexamethasone suppression test. And again, what happened? ACTH is still high, meaning it's going to the ectopic, meaning there is a what? There is a, it is associated with the small cell carcinoma. That's why there is a Cushing's disease. Okay, so please try to watch my videos there. All clotting factors, increase in pregnancy except factor 11 and 13. Please read all the physiological changes in the pregnancy. Okay. Next one, the first to PUS delivery seen in what? Verama? Anthropoid. Where? Anthropoid. Okay, now. Most common is the gynecide. Okay, now. And android is the for males, which is for the face to PVC is the anthropoid. Okay, na? So please try to read all the pelvis. Okay, that's a pelvis. Next, who will do the investigation for a case of custodial death? This is going to be judicial magistrate for the judicial magistrate. Executive where for exhumation and death he will do. Okay. Next one is the AMSA criteria where AMSA criteria for the what? For the bacterial vaginosis. And also please try to remember what does AMSA criteria includes. It includes total four things. Okay, na? So please try to go with that and try to also remember study about the trichomoniasis also. Okay. The next one is the trash system, red, yellow, green. Okay, so I think you know about that one, trash systems. Then next one, furosemide. What is the mechanism of action? To inhibit the sodium chloride 2C2 chloride at where thick ascending limb loop of what? Henle. Okay, now. And also, guys, please master all the diuretics, sparing diuretics. Okay, now potassium sparing diuretics, everything. Please try to, I explain this with these things in my notes very clearly with the neat diagram. Okay, now where does mannitol is acting, loop diuretics, where does cloth hazard is acting, okay, where does estrazolamide is acting. You have to know everything, so just please try to master that one. Okay, now next one, snowman appearance, where are the what tab we see here. So, shoe or boot appearance, what top for palette. Okay, X on what? TGA. So these are some important from the congenital heart defects. Okay, meaning, so you have to remember the image. Okay, please correlate with the images are important for that one. Okay. Next one, what are the side effects of the lithium? So lithium, you can the lithium, okay, na, the side effects as the lithium itself, may the mnemonic as lithium only, leave for what? Leukocytosis, if for insipidus, T for what? Thyroidium, okay, tremors, okay, na, H for hypo, it is a hypothyroidism, not a hyper, it is hypothyroidism, okay, lithium what ama, it is the hypothyroidism, not the hyper. Where in the amiodarone, it is the both hypo and hyper, okay. Also learn about the hypoamidon. Okay. Next in the Meckel's triad. Meckel's triad, where we'll see at what? Boerhaave syndrome. Where we'll see Boerhaave syndrome. Okay. Now there is a chest pain, vomiting, retching, and subcutaneous emphysema. Okay. Now, what is the Meckel triad? Tell me. Tell me in the comment. Okay. Next, the treatment is a thoracotomy plus a mediastinal lavage. Okay. Closure of the percussion. Okay, na? And also learn about the Miller-Wish syndrome. Miller-Wish syndrome means Miller-Wish syndrome is not associated with the subcutaneous emphysema and the Meckel's triad. Okay, now. Okay, na? But Miller-Wish syndrome is nothing but just due to chronic drinking, due to chronic alcohol or binge drinking, it causes the tearing. That's why in the Meckel's triad, but in the Boerhaave syndrome, this is a what? There is a subcutaneous emphysema, chest pain. Okay, na? But in the Miller-Wish syndrome, there is nothing. Only the bleeding was vomiting. Okay. Next one is the Hirschsprung disease. Hirschsprung disease is the congenital megacolon or aganglion, meaning absence of ganglion cells in the Auerbach's plexus. Auerbach's and the Bechner plexus. It is associated with the Down syndrome. Most common site, rectosigmoidal. Most common clinical features are what? Abdominal distension, delayed of passage of meconium more than 48 hours. Investigator's choice is the full thickness suction, rectal biopsy. Rectal biopsy surgery will be Duham's operation. Next, coming to the achalasia cardia, it is the failure of relaxation of what lower esophageal sphincter due to absence of what ganglionic cells in orobax or myotonic plexus. Also, it is defense of VIP and what NO. What is your NO? Nitrogen oxide. Okay, nitrous oxide. Okay, na. There is what? There is a Chicago. Okay, na. Chicago. What criteria for the diagnosis? For achalasia cardia, it is the Chicago criteria. There is a regurgitation, dysphagia to what? Liquid to solid. Okay, liquid to solid. There is a halitosis. Means bad breath here. Okay, na. Investigation of choice is the esophageal manometry. The diagnosis will be what? There is a barium swallow, but on the barium swallow, you'll see what? There is a Bodwig sign, and the surgery is the hellespectomy. Okay. Next one, the Meckel diet means Meckel's diaticulum. Meckel's diaticulum, guys, please try to remember the tooth rule. Tooth rule here. There is tooth rules rule here and tooth rule here in Meckel diaticulum. The investigation of choice is the technetium what 99 pectinate scan. Next is the please know study about the Crohn's versus ulcerative colitis and duodenal versus gastric ulcers. Okay, na? Which one is okay? Na? Please read about this one. These are very, 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 very important. Okay. The next one is the anatomical. This is the anatomical snug box. Okay, na? Try to. I think everyone knows about that one. What is the lateral border and medial border, roof, and content. Everything is important. Okay. Next one is the Broca's area here. This is Broca's motor speech. There is non-fluent speech. Okay, na? At the 45, what the number is 44, 45. One speech area is the fluent or receptive aphasia number. What number is area 22, 39, 40. One is connected to Broca's area by what? Arcuate fasciculata with injury. There is injury to fasciculata. Injury to arcuate fasciculata. It will lead to what? Conduction aphasia. Remember, angular gyrus. There is anomic aphasia, meaning it can't name the word if you injury to angular gyrus. Okay, now. Next is the uncinate. Next one is the uncinate fasciculata. If there is a what? If there is injury to uncinate fasciculata, guys, then there is a difficulty in what? Difficulty in auditory plus speech. Okay, na? That. So next one is the in JVP, C wave represent what? What? C wave represent what? Represent tricapsid bulging during the isovolumetric contraction. Canon A mean what? A represent what? Canon wave. Canon A wave represent what? Complete hot plug. The JVP is also important, guys. Okay. Next, treatment of vocal nodule is the what? What it is the voice rest matter. Okay. Then please try to remember our difference between the vocal nodule and the polyp nodule. Okay. Vocal nodule and polyp. Okay, na? Vocal nodule means what? This is called as Singer's nodule. This is called as Singer's nodule. Okay, na? Next one, the secondary active transport. Okay, na? These are the examples. Okay, na? Next one is the 34. I think everyone knows about this one. Single bubble, double bubble, triple, and multiple bubbles. Everyone knows about this one. Okay, try to correlate with the what? Images. Okay, na? Next one is the Maternal Termination of the Pregnancy Act, MTP Act Act 21, meaning until 20 weeks, until 20 weeks, so one doctor opinion, 22, 24 weeks, two doctor opinions. Okay, now that one, MTP Act. From this one MCQ. Okay. Next one is the male child recurrent epistaxis and Holman-Miller sign or Antar sign or Antar sign. It is associated with the J and juvenile nasopharyngeal angiofibroma. Next one is the ET blockage with hearing loss. Type B tympanometry seen in the serous otitis media. Okay. Next is the anticoagulants in the pregnancy. Anticoagulants in the pregnancy. So, listen carefully. Heparin is not given. Heparin is contraindicated. Heparin is contraindicated in the. See, listen carefully. If the patient is not pregnant, then you can go with the warfarin. Okay, na? Warfarin pregnancy. Next one is the in pregnancy 12 weeks. See, until 12 weeks, see here, until 12 weeks, you have to give the heparin. See here, because the warfarin is absolutely contraindicated in the very first 12 weeks, because if you give this warfarin in the pregnancy, it will cause the contrary syndrome. Because the contrary syndrome meaning there is hypoplasia of the cartilages. Okay, now then that's why you have to prefer until 12 weeks you have to give the heparin. What is either maybe it will be low molecular weight heparin and enoxaparin. Then 13 to 36 weeks you have to can give the warfarin. Okay, na? And 36 weeks what 36 weeks and the heparin. Postpartum you have to give the warfarin. Okay. The next one is the 39. What is prosopagnosia? Prosopagnosia. Prosopagnosia. It is the what? It is the unable to identify the own face. This is also a exam question. Acrophobia, fear of height, agoraphobia, claustrophobia, xenophobia, Frigoli syndrome, what are non-familiar person appears to be familiar. Capra syndrome means what are familiar person replaced by the imposer. Delusion means thought, form, false, form, belief, hallucination, perception without stimulus. Illusion means what are misinterpretation of a stimulus. Okay. Next one, drug of choices for this one. For the acute dystonia, benzaxyl, acute akathisia, beta blockers, propranolol. You can give tardive dyskinesia. You can give the valbenazine for the NMSS, that is the neuroleptic malignant syndrome. You can give the dantrolene. Tetrabenazine for the what? Huntington's chorea. Next one, you can here we are having the a good some tracks here. Trada pellagra here, pellagra, Pagelsman syndrome here, alkaptonuria, trad of hemochromatosis. I'm going very faster. Okay. Next, trad of hemorrhagic uremic syndrome, trad of pulmonary Wilson syndrome, trad of acrodermatitis, cardiogenic trad, Murphy's trad, Beck's trad, Charcot trad, trad of Rocky Mountain spotted fever, trad of Viscott-Aldrich syndrome. Aldrich means what? Itching. Aldrich itching. Itching. It means there is a what? Eczema. Okay. These are some important trads to master, guys. Next one is coming to here. Drug of choice for the status epilepticus is the IV lorazepam, meaning you have to go to everything. You have to go to all the seizures like GTCS, everything, infantile spasm, SCTH, GTCS. We can give the sodium valproate. So go to the topic and remember every drugs here. Okay. Next one is Erb's palsy. Now mainly involves what? Erb's palsy mainly involves axillary musculaneous subscapular radial nerve. Okay. Also read about the Klumpke's palsy and also the wing of scapula. Next, a thick smear for the malaria parasite identification. Thin smear for the species identification. Please try to read everything about the malaria. Okay, now about the malaria. Okay, na? And how we are going to identify the species. Okay, na? It is the falciparum. In my slide, guys, in the FMG short 150 slides, I already mentioned everything about that. What to study about the malaria. Okay. Next one is the cocaine poisoning. This is the next one. Cocaine poisoning. There is what tactile hallucination. Is also called a Magnan syndrome. Cocaine buzz, meaning is the patient will feel like something is going on. Is a what hand? Nasal septum perforation. Okay, na? Try to remember all the other cocaine poisonings. Okay, not all cocaine, other poisons also. Okay, na? Next one. Try to remember about the extradural, subdural, and subarachnoid hemorrhage. Subarachnoid hemorrhages images. Okay, images with that management and the most common sites. Okay, na? Next one is the IoT regurgitation. Try to remember the ARMS that like everything like types of the murmurs. I already made a good notes about that all the types of the murmurs. The most important is the IoT regurgitation. You'll see that what water hammer or collapsing pulse, the Corrigan sign, dancing carotid, hip high SBP but low DBP. Okay, now the soft S2 MDM called as or Austin Flint murmur. Okay, na? mid astral murmur called as asting fulfilled murmur. Try to remember others also. Next one, Wolf Parkinson White syndrome. What happened? There is a absent Q wave. As an absent Q wave, there is a white QR, there is delta view. That's a slope on the ascending limb of the what? R wave, short period interval, and inverted T wave. These are all included in the what? These are all helps to diagnose the what? Wolf or Parkinson White syndrome. Try to correlate with the images. Most common organ injury in blunt abdominal trauma, it is the spleen. Try to read everything. Okay, now this one. Next one, one MCQ from here. Next one, HSP, Henoch sclera, Henoch Lolin, Chol. Always, I don't know how to pronounce this one, guys. Henoch Chonlin. Henoch Chonlis purpura. I always remember HSP. HSP is very easy for us. It is a small visual vasculitis. Okay, na? Vasculitis most common in children's. Remember the mnemonic is the PAR. PAR is the mnemonic. P for the what? Psoriatic rashes. Uh, Abdominal pain, colicky, that is the arthralgia. Okay, na? There is a renal pneumonia which is the associated with the nephritis. Okay, na? Treatment is the self-limiting. When to give the steroids? When there is it involves the GIT. That's it. Please also master about all other vasculitis. Mostly they are giving about the HSP, Kawasaki disease, and the GNC arthritis. Okay, na? Please also try to read about the acute or chronic pancreatitis. What are the common causes, and what are the causes and the complications, okay, and the surgeries. These are the main important things. You have to know how we are going to do to differentiate between the acute and the chronic pancreatitis. Okay, everything is in my PDF, guys. Okay, try to master. Okay, thank you very much. We'll see you in the next video. Thank you.